It's up to us to identify what's important in the future that we want. And so a lot of this starts with a human need that someone's identified, hey, we can make a thing better. I really love technology and the way that it's transforming our world, the way we interact with it, the way we get to make lives better. And I felt that this would provide a layer of instruction and interaction. As well, it could be applied in later iterations into new ways that, again, help humanity, whether that's a natural disaster and making sure the right people are getting the right products. The Smart One is a vending technology platform which makes vending machines smart. So that allows us to be able to take old technology and map that now into an automated retail, just like you're seeing the self-service kiosks in big stores. We're doing the same thing now for other retail channels.
Again, we want those layers, right?
We asked a lot of the vending machine world if this was possible, and most of them didn't want to support it, didn't understand why we were doing this, and so we recognized they weren't really the right people to ask for permission. So we kind of developed the mantra, well, there's nobody to ask permission, so let's just do it. So once we actually had that physical piece of hardware in our hands, it was really rewarding to know that, well, where do we want to take this next? If this first piece could be done without the industry support, is this an opportunity for us to revolutionize? So are we maybe a little bit ahead of the curve? I think so.
Not only does it provide harm reduction supplies, but it also provides referral information, and with the touchscreen, it's a lot easier to operate, and it can also display information as well. For instance, there are drug alerts that are sent out by the Interior Health Authority in regards to the toxic drug supply, and so that machine can display those drug alerts when we're not here after hours, so obviously that's incredibly useful. So anytime social services, like any other industry, can integrate with technology, it tends to benefit the clientele, and obviously that's what we're grateful for sure.
They really like it because it's not competitive to what they're offering. In fact, it allows them to focus more of their time on those that fall outside of the normal day-to-day. If someone shows up there and they know what they want, they've already registered in the system, and they're being counted in some way, that's an automated piece that, again, they can come and go as they please. It's now the opportunity to reach those that come 24 hours a day, and what we've seen is that it's just as busy at midnight as it is at noon. So if it's that busy into the evening, who are we not reaching in that 9 to 4 window?
How to save someone's life.
You know, my employees kind of laugh a little bit when I say that every time a machine breaks, my heart aches. You know, like, it really is true that, you know, I'm tied to the outcome of our company, obviously, but in the way that this has affected so many individuals, 100 to 150 individuals access one of our machines every day. And we've got them in British Columbia and New Brunswick, and now they're going to be across every province in a large push. But ultimately, knowing that this is providing a line of infrastructure that allows stigma-free, barrier-free, as well provides direct connection to those services, I think is extremely valuable. And I think we've really only chipped away at the start of what this communication and self-service network will mean for public health care in the future.